Hello, my name is Scott Swanson. I'm your host for today's Field of Work webinar. It is brought to you by North Dakota State University Extension, and we're celebrating a milestone this year here in 2025. This is our 10th year we have done the webinar series, and we're so glad you're able to join us today. So we have archived all our previous years, so we have more than 100 webinars, and those are linked. The links to those are on our Field of Work webinar page. The next slide will show our upcoming webinars. We hope you can join us for these as well. And the next slide there shows us the webinar controls. Because of our large number of participants, we invite you to post your questions and comments in the chat. So let's practice finding and using the chat box. So please ignore the Q&A box. That's one of your options there too. So click to open up the chat and go ahead and type in your city and state today. It's always nice to see where everybody's joining us from, people from all across the country we've had for many of our previous webinars. The next slide provides an acknowledgement. So while you're typing in your city and state, we want to let you know about a special request we have. So this program is sponsored in part with grant funding from the USDA's Agricultural Marketing Service. And so we're going to ask you to complete a short online survey that will be emailed right after today's webinar. And as a thank you, we're going to provide some prizes to the lucky winners of some random drawings. So be sure to put in your complete address on the follow-up form, including your city, state, and zip code. You will need to scroll down to find today's date because we are combining our data from 2023 and 24. So when you get that survey, scroll down to find today's date. Again, welcome to today's webinar. I am pleased to introduce today's speaker. Byron Chaves is a food safety extension specialist at University of Nebraska, where he provides training and technical assistance to food manufacturers in food safety, sanitation, and regulatory compliance. He is a native of Costa Rica and obtained his PhD in 2015 from Texas Tech University. Byron, the floor is yours.
Thanks, Scott. I appreciate it. Can you hear me okay?
Yep, hear you good.
Great. Well, good afternoon, everybody, and thanks for having me. This is actually my fourth time giving a talk at this webinar in this webinar series, and congratulations to Julie and her team for making it to 10 years. This is a phenomenal webinar series. I've actually been thinking of stealing this idea and bring it to Nebraska, but I haven't done that yet. But anyway, my name is Byron Chaves. I'm an associate professor and food safety extension specialist here located in Lincoln, Nebraska. I am on campus. And today we're going to talk about recalls. When we think about recalls, of course, we think about the news, right? So lots of things that we hear in the news, but I'm going to hopefully give you some background on what does it actually mean to have a recall? How do those happen? And what are some of the things that as small processors or maybe food entrepreneurs we could be doing to implement recall strategies? So the first thing that we're going to do this afternoon is we're going to have some online engagement. I want to see where we are in terms of your current operations. You can also scan that QR code. So I'm going to give you a couple more minutes or a couple more seconds. So this is the option that best represents your current food operation, right? So whether you are FDA inspected or FSIS inspected, maybe you are inspected by the state. Regardless of the state or territory that you are located, maybe you are a dual food facility, and so you have both FDA and USDA. Or maybe you don't have any of those, right? Maybe you are working for or under cottage food law, or are starting your business, or you're simply here to learn something new. So just a couple more seconds. So keep in mind that the FDA is the US Food and Drug Administration, and the USDA FSIS is the United States Department of Agriculture, and then FSIS is the Food Safety and Inspection Service, and it's basically the branch of USDA that deals primarily with food safety. Okay, we're gonna move forward. Seems like you guys are not in any of these categories, so that gives me some really good information. Okay, the first thing that I like to do in most of my talks is to define what a food safety hazard and a food safety risk are. Okay, because we typically confuse these two terms, and the reality is that they are not the same. So a food safety hazard is any physical, chemical, or biological agent that it's capable of causing illness or injury in the consumer. And what we want to do with food safety hazards is eliminate them if we can, but sometimes we can only control them or reduce them to an acceptable level. That will depend on the type of food product, the type of hazard, and many other factors. But keep in mind that the hazard is the actual agent that can cause illness. And then the risk is the probability that that agent will cause illness or injury in the consumer. And what we want to do is to make that probability as small as possible. Okay. Now, there are two main factors that affect that probability. One is how frequently do we find that hazard in the food product process combination, and the other one is the severity of the illness that it's caused by that hazard. And there's very few things we can do about the latter one, so we can't really, control listeria or salmonella or any microbe, but we can certainly work towards reducing the probability of finding the hazard in the food product combination, and that is where recalls come in. Okay, let's start here with some other definitions. So a recall is basically removing the product from the market when there is a reason to believe that the product is adulterated or misbranded. And for now, and for simplicity purposes, we're going to define adulteration as direct contamination, although there's many different types of adulteration. So when the product is contaminated, it could be adulterated. And when the product is mislabeled, it could be misbranded, right? So these are the main two regulatory enforcements by the federal and state governments. So adulteration is basically when the product is contaminated, and misbranding is when the product is mislabeled. It's not as simple as that, but we're going to go with that for now. Now, two things that are highly related to recalls, or two definitions, is stock recovery and market withdrawal. Stock recovery basically happens when the product is still within the facilities or distributors, uh, you know, uh, uh, the storage or channels if they're in a warehouse that still belongs to the company, and so it's easy to recover those products. So they're not going to be recalled; they're just going to be recovered from a storage facility, for example. And another one is market withdrawal, which is basically the same as a recall, but for minor violations. We don't see a lot of market withdrawals in foods. We see a lot of those in things like cosmetics and other types of products. Okay, so they are not recalls, but they are very similar or act in a similar way. Okay, remember we talked about the definition of risk, and we said that risk is the probability that a hazard will cause illness or injury in the consumer. And so the way that recalls are categorized is by the type of risk, by the level of risk that it's associated with the hazard. And so a class 1 recall is the one where we find a hazard that it's likely to cause illness or injury, right? So think about E. coli or salmonella and those other big microbes. Or it could be the presence of an allergen that hasn't been declared, okay? Now, a class 2 recall is when we have situations that are not posing a direct risk to the consumer or a direct health hazard to the consumer. In foods, we typically see class 2 recalls with spoilage or maybe things like incomplete labels, right? So those sorts of things we typically associate with class 2 recalls, but keep in mind that class 1 are really the ones that we care about in terms of food safety. So we don't want to be associated with a class 1 recall. That's basically what we're trying to say. Okay, more background on food recalls. And so hopefully this is going to add some clarity around this almost mysterious way that food gets recalled. Okay, so I mentioned two federal agencies, the FDA and the USDA. The FDA has the authority to recall, to mandate recalls. So they can tell a company, hey, I need you to remove this product from the market because it could be making people sick. And then the companies have to comply because the FDA has congressional authority to mandate a recall. The FSIS, the USDA FSIS, is a little different. They do not have mandated recalls. All of their recalls are voluntary. So when we think about meat and poultry products, which are the foods inspected by the USDA FSIS, all of those recalls are voluntary technically because the USDA does have a lot of power to make those companies recall the product. Okay. And then states, of course, have some power. States have a lot of power in determining what products can circulate within their limits. And so they can seize and destroy product that it's deemed unwholesome or unfit for human consumption or it could be for animals, right? Because when we are thinking about food, it could be animal food or it could be human food. So let's keep that in mind. Okay, when we think about recalls, right, we look at we watch the news and we read and we hear and we listen of products that are getting recalled from the market. And it's typically because of things like listeria or E. coli or allergens or potentially foreign material. But how are these products actually discovered, right? Like, how do we discover that we have a problem with foods that may already be in the market? Well, the first way is that companies contact federal or state agencies. That is very common, right? Because companies that are registered with the federal government, whether through the FDA or the USDA, have ways to communicate with those federal agencies. And so they can say, hey, we tested our product or we reviewed documentation and we found a problem. And so this product could potentially be making people sick. And so we want to remove it from the market. And then the state and federal agencies will come in and help. Okay. Federal or state agencies identify a problem through surveillance, right? So they can come to your facility, collect samples of food and food processing environments, and potentially determine that there is direct contamination. Or maybe they have established that the food was produced under unsanitary conditions and therefore it cannot be in the market. Okay, so federal or state agencies can come. The inspectors can go through your documentation and potentially identify, for example, if a product was under processed, right? So think about a food that it's pasteurized, maybe the temperature wasn't the right temperature. And so there is a possibility that bacteria may have survived in that food product and make people sick. And then this fourth one is a big one, right? This is when people actually get sick. And so then the US CDC, the Centers for Disease Control, gets involved because somebody gets sick and or there are direct consumer complaints. And we don't want to get to that. But in many cases, that is how we discover that products were actually contaminated. We've discovered it because people got sick with that product. Okay, so then hopefully this is giving you some ideas of how this process actually happens. It is fairly complicated, but I'm going to give you an idea of what happens with FSIS recalls, right? So remember that the USDA is in charge of inspecting meat, poultry, processed eggs, and also catfish. And then everything else is basically left for the FDA. But in the case of the USDA, they have a recall management division. And this recall management division is the one that works directly with industry to identify what is the type of recall that has to be passed, right? Whether it's a class 1, class 2, or class 3. But they also work very closely with news outlets to release notifications, right? So for class 1 and class 2, which are the highest level of risk, right? So remember, class 1, it's when we have a product that's potentially going to make people sick. Then in those cases, the USDA will work directly with national news, right? That's why we see things on the radio, we see things on TV, on social media, when there are these big recalls, because they are responsible for informing the public, right? The company can also inform the public, but they typically work with the USDA to do that. One of the big things that needs to happen is that as a food producer, regardless of the level of production, right, whether you're small, very small, medium, large, whatever you are, you need to have a list of people that you are selling your product to. So even if you're just putting product in a local convenience store, you really need to make sure that you know where your product is going to end up, just in case something goes wrong. Now, if you are under USDA inspection or know somebody, then of course you can send them to this to get information from this FSIS directive that will tell you a little bit more about implementation of recall plans. And if you want to have a federal inspector on site and get a grant of inspection from the USDA, you must have a recall plan. So it's always a good idea to start thinking about these things and using these tools that are available just in case you want to expand your operation. So let's take a look at what happens with the FDA, right? The FDA is a completely separate agency, and they inspect pretty much every food commodity except for meat, poultry, processed eggs, and catfish. The FDA inspects roughly 80% of the food supply in the US. And then, of course, the other 20% is mostly the USDA. Now, the FDA and the USDA are very separate agencies, right? And they don't particularly communicate super well with each other. Some of their methods are the same, some of their regulatory definitions are the same, but the approach to implementing and enforcing regulations is quite different. Okay, so the FDA takes a more hands-off approach with recalls, and so they wait for companies to reach out to the FDA and say, hey, we might have a problem with my product. A recall may be needed. And so then at that point, the FDA will start working more closely with that company, asking a lot of questions about lots, right? So lots of production, date, type of product, where did it go, who's buying this product, did it cross state lines, what states is it located, was it placed in retail? All of those questions really need to be answered, and so the company will work directly with the FDA. Now, one resource that the FDA has that it's really, really good, and if you are a small operation and you are not registered with the FDA, that's totally okay because maybe you don't need to be registered with the FDA. Maybe you have state license, maybe you're working with cottage food. But if you eventually think that you're going to grow enough in a way that you want to put your product across state lines, then you must have a facility registration number. A facility registration number is basically a number that identifier that the FDA will give you so that they have information about your food operation and they have you in this registry and they can come and visit your facility and your operation to do inspections. Okay. So the reportable food registry is this portal where food facilities that manufacture, process, pack, or hold foods for human consumption or animal consumption can put their information, especially when something goes wrong. Okay. So these facilities are required to report when there is a reasonable probability that the use of exposure to an article of food will cause serious adverse health consequences, death to humans or animals, right? So the big hazards, the one that have a really high severity, high consequences. So the reportable food registry, again, really important resource. We want to use the reportable food registry when you are registered with the FDA. If you are not registered with the FDA because you're a very small operation, or maybe you're retail, maybe you're food service, that's totally okay. You don't have to be registered with the FDA. But if you eventually want to grow your operation, you will have to be registered because you will likely put products across state line, whether physically, right, having a store or placing your product, let's say from North Dakota to Minnesota or from Nebraska to Iowa, whatever you are located, whether you physically sell your product in another state or whether you do online commerce and that online commerce takes your product across state lines. So just keep that in mind as you think of growing your operations. Now, the other really good resource that the FDA has when there are recalls is that they have this model or almost like a template, excuse me, press releases. And so these are the ones that we see on the news, right? These are the ones that we see on the news where there is, let's say, the name of the company, they're recalling a type of product because of allergen contamination, for example. And so the FDA does provide this kind of support for companies. And the reason why they have these templates is for risk communication, right? So remember that if you are in charge of, telling people that your product has been associated with a recall, you may leave some important information out or maybe put too much information that it's going to confuse the consumer. So the FDA has these model press releases that are really good to standardize risk communication across recall situations, okay? Okay, you may be thinking, fine, all of these things sound so regulatory, doesn't really apply to me. Well, it may not apply to you as a food manufacturer or processor, but it definitely applies to you as a consumer, right? So we're all, as consumers, we're all at this end of the food supply, where if something goes wrong in that food supply, we may be affected. So the leading causes of food recalls in the US is, well, number one, the presence of undeclared allergens. Right. So when we think about allergens, remember these are proteins, mostly proteins in foods that can elicit an immunological response. And these are the 9 big allergens in the US. So eggs, fish, milk, peanuts, sesame, crustacean shellfish, soy, tree nuts, and wheat. Okay, so these are the main allergenic foods. And most of the recalls that we see in foods are associated with either not declaring an allergen on the label of the product or declaring the wrong allergen. Okay. Now, the reason why this is so important is because keep in mind that people that have food allergies rely heavily on reading the label, right? So they read the label to follow what it's called avoidance diets. And so they are reading the labels to avoid the allergenic ingredient that could potentially kill them, right? And so not having an allergen on your label that is present or not declaring that allergen is a serious violation. And that typically leads to class 1 recalls, right? Remember the ones that have the higher level of risk. Now, the second leading cause of food recalls in the US is the presence of pathogenic bacteria. And the three most common pathogenic bacteria that we find in foods associated with recalls are Listeria monocytogenes, Salmonella, and E. coli. Okay, everybody has heard of Salmonella and E. coli, but maybe you haven't heard of Listeria. And Listeria is a particularly problematic foodborne pathogen because of the type of illness that it causes. It has a very serious type of illness, especially for immunocompromised individuals, pregnant women, small children, and older adults. And then cause number 3 or leading cause number 3 would be foreign material. This is typically metals, plastics, glass, rocks. We've seen lots of examples of this, right? So we've seen metal shavings and metal pieces in ground meat, in taquitos, in ready-to-eat food products. Lots of these situations that typically arise because of a lack of good manufacturing practices or preventive maintenance during food manufacture. Okay, now here's another engagement question for you guys. And so if you go to Slido, use that same number that we had before. And the question is, are food recalls on the rise? And so here's the options. Yes, they are definitely increasing. The other one is a more conservative yes, and the other one is a no. Okay. I didn't have a maybe, but most people seem so far leading for yes, they're definitely increasing. We'll see what others say. You know, we see these things on the news all the time, every day. And of course, as a food safety specialist, I'm always keeping track of these things and paying attention, reading the news. I get questions all the time about, hey, what's happening with this product that got recalled? Or there's an outbreak going. Should I not be consuming that product? As food safety specialists, we get those sorts of questions all the time. So just a couple more seconds. And most people are leading so far towards a very categorical yes. They are definitely increasing. Some other people are a little more conservative, and a few people have said no. Well, the reality of the numbers, right? So the data doesn't lie. And the reality is that they are not so far in with the data that we have for 2024. We cannot decisively conclude that food recalls are actually increasing over time. When we see all of this news of food recalls, right, and food safety recalls, and listeria and salmonella and foreign material and allergens, those are advertised for a reason. Those are advertised heavily so that people can prevent consuming that product and potentially getting sick, right? So, yeah, could it be that foods are becoming more unsafe? It's unlikely, right? Typically, what has happened is that we have better systems of finding product that it's contaminated. And sometimes, unfortunately, a lot of those instances, we only catch the product when it's already in the market. Although most of the food contamination, right, most of the contamination that happens in foods is discovered before the product goes to market. Some contamination, it's only discovered after the product is in the market, and that is when we have food recalls. But in general, there's not more food recalls now than there were 5 or 10 years prior. Okay, so the data, it's pretty stable. Now, one of the reasons why we might think that there's many more recalls is because a lot of the situations that we've had recently have involved food ingredients, right? So if we think about peanut butter, so peanut butter contaminated with salmonella may be produced at a single food facility, but that peanut butter went to 100 different companies to be used in 200 different products. And so we see lots of recall notices of different types of food products, let's say pastries and I don't know, frozen peanut butter chicken. We see lots of different food products that are associated with direct contamination of one of those ingredients, right? And so it may seem like food recalls are on the rise when in reality, it was mostly associated with one ingredient. And that is a typical case that happened in 2024, where we saw lots of ingredients being implicated in food recalls. Okay. Now, that does not mean by any means that as consumers and as an industry and from a regulatory perspective, we could be doing much more, right? We could be doing much, much more to protect the food supply, although we already have a fairly safe food supply. Okay, this is what I was telling you, right? We see these things and these notices on the news all the time. We see in this example, let's see, the first one is undeclared allergens, wheat and eggs in pancakes and other food products. This one, the second one is interesting, right? This is canned tuna that was recalled potentially because of the presence of Clostridium botulinum. Now, it is unlikely that a product like canned tuna is going to have Clostridium, right? But what could happen is that during the revision or review of the documentation, it was discovered that the product was under processed, right? So instead of being retorted at the right temperature and pressure, maybe the equipment failed, right? Maybe there were other circumstances that may have led to the product being contaminated. But most of these recalls, keep in mind, are never associated with illness, right? So it's not every recall leads to illness, and not every illness of foodborne illness actually leads to a recall, right? So they're not always, they don't always go hand in hand. Now the other examples that I have here, let's see, top right, that is foreign material contamination. I believe that was metal, could have been plastic. Another one, it's a ready-to-eat meat product that was potentially contaminated with Listeria monocytogenes. And the other one, it's an interesting one. That is raw pork sausages that were produced without the benefit of inspection. And that is another good reason to recall a product. When a product was produced without inspection, whether that inspection was federal or state or local, foods have to be inspected at some point. Foods that are going to be placed, in commerce need to be inspected at some point. And so without that benefit of inspection, who knows if people were doing the right thing? Okay, what can we do, right? So when we think about recalls, it seems like a daunting task to have to develop a recall plan. But no one is exempt from having their product implicated in a recall or somebody getting sick, right? So as small food manufacturers, as processors, as entrepreneurs, as maybe people that are thinking of growing your food operations, what are the things that we can do? Well, definitely work on prevention and compliance, right? When we think about preventing contamination, we are thinking fundamentally of good manufacturing practices. This is the least we can do. We need to really make sure that we have traceability records, and it doesn't have to be anything complicated, but we need to know what were the ingredients, who supplied those ingredients. Even if we just go to Costco or Sam's Club and buy the ingredients for the product that we are making, we really need to keep track of where am I getting the products, what kinds of products did I use, and who supplied those products. Now, if we have more complicated supply chains, of course, we want to know the production batches, right? When did I make this product? What is the lot number associated with that product, and any distribution channels. So this is really for traceability purposes. Okay. Now, when we're thinking about developing a recall plan, which is what I just mentioned, right? This can be a daunting activity, but we really want to establish clear communication protocols. If your product is implicated in any instance of contamination or misbranding, and it needs to be recalled from the market, you really want to have good communication with your state regulators, maybe with your local extension program, right? So with Julie, with others on campus, in the case of Nebraska, with me and other extension specialists, so that we can provide some support on how to approach communication with the regulators. Now, you also want to keep good communication with your suppliers, distributors, if you send any any samples for testing, right? So you want to have this really good open communication so that in case that something goes wrong, you can provide adequate documentation to identify where the problem started. Okay, we want to detect and assess issues, right? So this is mostly small operations or entrepreneurs. We don't typically think about the suppliers, and that is a big issue, right? We're thinking, well, I bought this at the supermarket, or I bought this from a trusted source, but we really need to qualify what a trusted source is. Do we trust all of the produce that it's been sold in the farmer's market? Do we trust, you know, anything? You can really say the same for any ingredient. And so one resource that I have here is this. This looks, of course, this is a picture that I took from the web, but there's this group called the Food Industry Council, and they keep a database of recalls in the United States, and it's actually really good. It's a really good database, and so if you have suppliers, you definitely want to go and see if any of your suppliers have been associated with recalls in the past, so you can make decisions. You can make decisions about, the quality of your suppliers. Okay, a couple other things here. Executing a recall. This is basically physically removing the product. So when we are thinking about executing a recall, that is, like I said, actually removing the product from the market. Okay, and to do that, if the product is contaminated and it's already in the market and it's already across state lines, it might be fairly difficult to retrieve that product, but we can certainly work with regulatory agencies, suppliers, customers to remove that product from the market. Okay, after we remove the product from the market, we really need to know what are we going to do with the product that was contaminated, right? So we need to make sure that nobody can have access to that product thinking that it is fine to consume when in reality it may be making people sick. And we need to identify the root cause analysis or the root causes for the recall, right? So where did contamination come from? Did that contamination arise because of a lack of good manufacturing practices? Was it because an ingredient was contaminated? Wasn't because the equipment wasn't properly cleaned and sanitized, right? So all of those things really need to be identified. And I know from the beginning, you guys identified that you're not under federal inspection, maybe not even under state inspection. And these are things that we really want to think for any level of food production, right? Because regardless of the level of food production, whether you work in a manufacturing facility or whether you're making food at home for sale at your farmer's market under cottage food law, no one is exempt from having an event of contamination that can potentially make somebody sick. And so we want to start thinking about what are some of the actions that I can take to protect my brand and to protect my business when somebody gets sick, right? Do I have the right kind of documentation? Can I identify if it was an ingredient that was contaminated and it wasn't my actual operation, right? So we really need to start thinking about liability. Okay, after there's a recall, we need to do an evaluation, and that is typically identifying if the corrective actions that we followed will effectively prevent the type of contamination that I had that can potentially lead to a future recall. Lastly, the last two things that I want to talk about before we go to the questions is the level of recall, right? And this, as consumers, this is interesting, right? It doesn't necessarily apply to you as food preparation operations or anything like that. But when we think about recalls and implementing a recall, we really think on different levels. The first one is the wholesale level, which is when the product has been distributed to a warehouse or distribution center, but it hasn't made it to, let's say, retail or food service or domestic settings, right? So it's easy. So we can typically recover something like 80% of this product. Now, once the product is in retail, right, like the supermarkets, convenience stores, it is harder to recover, right? So a lower percentage of that product is going to be retrieved. If it's already in hospitality, in hotels, in food service, it's also very difficult, right? Because people are ready to use that product. And of course, if the consumer already has the product, it's almost impossible to retrieve the product. And so we can typically expect to have a um, recall yield of less than 5% at that point. So the closer to the consumer the product is in the market, the harder it is to retrieve that product. This is very important for facilities or operations that sell directly to consumers or in farmers markets or in local convenience stores or anything like that, right? At that point, when the consumer already has your product at hand, it's almost impossible to retrieve it. And so the best thing that we can do is inform the consumer they should not be consuming that product because it can make them sick. And also that they shouldn't give it to their pets, right? Because pets can also get sick with food that it's contaminated. Okay, and then lastly, this is really my last slide on what should we do when we implement recalls at any level, right? So really, we want to do recall simulations, and this is basically determining how effective my control measures are to retrieve product from the market. I'm not going to go through all of these steps, but this is basically, companies will identify a product and then follow that product into one retail location. Let's say that I am producing a product and I distribute that product at Costco's across the Western United States. Okay. So then I'm going to choose one product that I produce, let's say in Nebraska, and I am going to follow that product up until two stores, one in Oregon and one in California. Okay. And determine how effective I am at retrieving or removing that product from the market. That is called a recall simulation or mock recall. And it really helps facilities identify what are the chances that they're going to be able to remove product from the market if that product is found to be contaminated. Okay, so hopefully this has given you some idea of how recalls happen, the complications that arise, of course, with implementing recalls, and what are some of the things that you can do to protect your brand and your business in the case that a recall has to be passed. Okay, so with that, I'm going to go to questions. I know this was a super brief, quick overview. But hopefully you guys have some questions and we can have some fun answering.
Oh, yes, yes, they're coming in. Thank you everybody for posting questions. I do apologize. I forgot to change the settings to allow everybody to see everybody else's comments, especially where they're from early on. So a lot of you just sent them to the hosts and panelists. But I do want to let those know and Byron know if you didn't see it. But yeah, we had lots of people from North Dakota and Minnesota. We have some watch parties going on in North Dakota. Some counties, Pembina County and Stutzman County, are having some watch parties. There's a lot of people from Iowa, a couple from Kansas, Ohio, Pennsylvania,
Wow.
California, Alabama, Indiana, Illinois. I saw all those, and then even Canada and somebody from Pakistan who uh,
Wow.
who
This
logged
is
in.
pretty
Yeah,
impressive.
yeah, and then lots of questions coming in here. So let's get started on those. I'll jump to the top here and find
Mhm.
the first one that came in. So it said, this person said they know people who make food products and body balms with food grade oils. And then they take it to stores. There's a store in Fargo. They mentioned Tochi or the North Dakota Made store in the West Acres Mall. Are these at some point inspected?
Yeah, okay. So it depends, right? So not everything it has the same level of inspection. So let's think from top to bottom, right? So when we're thinking about USDA, FDA, these are inspectors that actually come to your process and operations. Then you can have a state inspector that can also come to your operation and review records, collect samples, those sorts of things. But in many cases, it's really the municipality or the county that it's doing the inspection, right? So the closer we get to something like a cottage food, the lower level of inspection we have, right? Because maybe somebody from the state or your county is going to come and take a look at your kitchen eventually, but it's very unlikely that they're going to be coming to your operation very often. So I would want to say in an ideal world, um, no food that is placed in the market has not been inspected. but that is not the reality of our food system, right? There are some food products that have never been inspected, right? Even if they do have a license for production. So there's that. Now, when it comes to body balms, food grade oils, right? I would say um, make a note that that product, that body balm, is not edible, right? Even if it was created or made with a food grade oil. Something that it's food grade simply means that it can be used in food production. It doesn't necessarily mean that it's safe to consume, right? So let's think about food grade lubricants that we use in industrial food manufacturing, right? So that food grade lubricant just means that it can be used on an equipment that it's going to come in touch with food. But if you take a spoonful of that lubricant, you're likely to get sick, right?
Okay, that the same person said on the same note, what about food trucks? All the food trucks that are around, especially up here in the summertime.
Yeah, food trucks are under state inspection, right? And they follow practices of the food code. So I don't know, for those of you in North Dakota and other places, what version of the food code you guys are using. Right in Nebraska, we're using 2017, but there is a more recent food code. It's the 2022 food code. But certainly food trucks follow under retail food safety inspection. And so it will be up to the state to develop controls and inspections for those, right? So mostly cross-contamination, temperature, access to potable water, those sorts of things. But yeah, food trucks are never going to be under federal inspection, so it will be up to your state.
So there's a couple of different comments or questions kind of about the layoffs that their people are concerned about within the federal government, and so they're wondering if there's anything related to food safety or the food inspectors. Has any of the layoffs kind of affected that area?
I am not exactly sure if any of the existing regulations are going to go away, but what we do know is that at the highest level of of government and regulations, there's been a number of fires, right? And so a number of terminations. And so those terminations could potentially influence, how food safety operates, right? Because we certainly want to have the most highly trained people making decisions. And so that could be a factor.
You had one in the chat and there was one in the Q&A that were kind of similar about contaminate disposing of the food. I know you kind of went over that a few on your slides, but there's maybe an area you could expand on a little bit. The one person was wondering, how do the companies dispose of it? Somebody else asked, like, what happens to the food when it does get recalled, the product, what happens to the product?
Yeah, so those are great questions, right? So typically for meat and poultry products, right? So when the products get recalled for whatever reason, especially if direct contamination has been established, right, with a pathogen like E. coli, Salmonella, then those products typically go to rendering, right? Because they cannot be used for human or animal consumption at that point. So a lot of the product goes to rendering. Some products may be able to be reworked or reprocessed, right, and be sent to a different product, or maybe be sent as a byproduct of human foods that it's going to go to animal foods. But even in that case, right, in that case, you still have to demonstrate that the product is safe for consumption by animals, because current regulations establish that the hazards are either for humans or for animals. The reason for that is because we are in very close contact with animals, particularly pets, right? So dogs, cats, people sleep with their pets. Babies, toddlers are going around and eating pet food that it's on the floor, right? So we know that those things happen, and so then regulations apply to pet food for the close contact that we have with animals.
All right, one here in the Q&A that might be a good. They're asking if cottage laws are different in each state. Are they different in each state?
Yeah, so cottage food is basically the type of law that allows you to make food at home for sale, right? For resale. So typically, we used to be able, obviously, we are able to make food at home, but a cottage food allows you to make a business, right? And so the difference, every state has a different cottage food law. The most recent state to approve cottage food law was New Jersey a couple of years ago, and now all 50 states in the union, you're allowed to make foods at home for resale. The difference between states is the type of products that can be sold. In our states, in Nebraska, in South Dakota, in North Dakota, in Wyoming, in Montana, we have what it's called, the regulations are a little more permissive, which is not necessarily good, right? Yeah, we want people to be able to make foods and sell and have a business, but some of these foods are actually very high risk, right? And so the difference between states is that some states allow some higher risk foods to be made at home and be sold for consumption.
All right, here's a little longer one. So, are food logistical transportation companies required to report problems if food accidentally is altered during the transport, like thaw and then freeze again?
Yeah, good question, right? So manufactured foods that are being distributed across the nation, especially if you have companies like a Kellogg's or, think about big companies, right? So there are federal laws that apply to foods that are being distributed, especially for FDA inspected food commodities. So for FDA inspected food commodities, there is a federal regulation that it's called sanitary transportation of foods of human for of foods for humans and animals. And so that basically requires distributors and transportation companies to ensure that safe practices are being followed during distribution. Now, the same would happen for any other type of food commodity, but if you're under USDA inspection, you would call that a little different. As a company, you really have to work with your distributors and transportation companies to make sure that temperature, relative humidity, prevention of cross contamination, that you have provisions for that during transportation of your food commodity. Because at the end of the day, you're ultimately liable for the safety of that product.
All right, we got one about eggs here. So, how do processed eggs differ from eggs coming from the backyard or the farm chickens? Should one take additional precautions when getting eggs directly from the producer?
Yeah, so it depends, right? So when we think about processed eggs, keep in mind that we can have the big two categories are shell eggs and processed eggs. So shell eggs, of course, is just the intact egg. A processed egg, it's really anything after you break the egg. As soon as you break that shell, we consider that to be processed. And then that processed egg will go to pasteurized liquid eggs or to powder eggs or anything like that, right? Now, in the United States, in commercial egg operations, they wash the eggs, right? The eggs are washed. And because the eggs are washed to remove sometimes fecal material, to remove any kind of other material from the surface of the eggs, because we like our eggs to be shiny and to be really clean and really pretty, um, we have to refrigerate them because that washing process actually removes the outermost layer of the egg that is called the cuticle. And that cuticle provides a lot of protection against pathogens and other types of contaminants. And so because we no longer have that cuticle, then we have to put them in the fridge so that we know that pathogens are not actively growing on that surface. Okay. Now, the difference from a local or a backyard, it may be that they're not washing the eggs. And if they do not wash the eggs, then it is perfectly okay to keep them at room temperature. Okay. So you just need to make sure. If you buy the eggs at the store and they are refrigerated, come home and put them in the fridge. If you buy them from somewhere that you know that they haven't washed them and the cuticle is intact, you can keep those eggs at room temperature, until they go bad.
Go to this one that just came in because it's kind of followed up to that transportation one that you just answered a second ago. They're asking about the trucks that bring frozen seafood from the coast to our landlocked states and who regulates those.
Yeah. So if they are, that's a great question because I really like to eat oysters. And of course, we live in landlocked states, right? And so those oysters um, are always going to be overnight or whatever. Um, so during transportation, if it's for um, facilities that are registered with the FDA, let's do an example, right? So maybe they're bringing oysters and other type of seafood from Louisiana and they're going to North Dakota, right? And so they will drive, let's say, through Nebraska. And so if that product has been transported for domestic consumption and they start somewhere in the US and end somewhere in the US, the sanitary transportation rule will typically apply to those transportation companies, where they need to make sure that cross-contamination and temperature controls, that cross-contamination is prevented, temperature controls are adequate. Now, for any other kind of company, you still have to have oversight on that transportation, right? Because like I said, ultimately liability falls on you. If you are working directly with a food transportation company, right, a company that specializes in food, they will know what to do. But the reason why we have these rules is because we've seen a number of cases where cross-contamination actually happened during transportation. It didn't happen during manufacturing, right? And so then we need to make sure that transportation is not the source of contamination. Let's see, who regulates them? Well, in the case of FDA inspected food commodities, then it is the FDA. In the case of the USDA will not regulate them, but the USDA will work very closely with the manufacturer in helping them ensure that that safety during transportation. But there's a lot of liability that falls on the manufacturer because they're the ones hiring the trucks.
This one was posted maybe still when you were doing your presentation, so it might have been pertaining to a certain slide, but it says, who pays for inspection services at the time of processing?
Yeah, the taxpayer pays for inspection of most food commodities with a lot of exceptions, right? So if all of us as taxpayers will pay for a certain number of hours in, let's say, in a USDA inspected slaughter operation, and after hours or holidays or a really high volume, then that company starts paying that fee for having the inspection directly to the federal government. But if you have an operation where you just have a few head of cattle that you're slaughtering, you have a grant of inspection that is actually free, right? So the thing that it's not free, it's to create the office for the inspector. All of those things are an added cost. But the short answer is the taxpayer.
All right, I got one more here in the Q&A, but there's still some time here, folks. So if you have some more, post them in the chat. The last one I see here in the Q&A, are there regulations for donating garden produce to the food shelves?
So that is a great question. And there's some gray area in there, right? Because let's say that you go to a CSA, yeah, to a CSA. You collect all of your produce. Those farms may or may not be under the produce safety rule, right? So the produce safety rule is the rule that basically for qualified farms that ensures that they are following adequate sanitary practices, preventing cross-contamination, using the right water, disposing fecal material in adequate ways, all of those things, right? So some of these very small farms may not be under the produce safety rule, but they still have to follow good agricultural practices, which is the most basic foundational things that they can do to ensure food safety. So when they pull all of these produce together, sometimes you don't know where contamination came from, right? But if they are not under federal inspection, then it's not really a type of inspection, but it's a rule, but they don't typically get inspected the way that food facilities do. They should be under state jurisdiction.
How about for like locally, like your individual gardeners? I know like even for extension, we have our master gardeners. They do a lot of they do like large garden areas and then they donate that to food shelves and stuff. So if you're just an individual gardener yourself, is that
No
okay just
one,
to take that right to the food shelf?
yeah, but no one is actually ensuring no one is actually ensuring the safety of your product, right? So it's one of those things where we can't, like I said at the beginning, ideally we would have all food commodities inspected at some point, whether it's by the feds or the state or your county or your Department of Health, whatever. But in some circumstances like that, there's a lot of gray area. And so they can adopt some of the provisions of the produce safety rule, and it is in their best interest, right? So the produce safety rule will tell you, for example, what kinds of manure and biological amendments to use that are going to be safer and in what way to use them. But because they are very small farmers or backyard, there's a minimal level of inspection.
Okay, Byron, there was one more that I'm going to repost it in the chat just so you can
Yeah,
see it. Um, to see, I think it might have been during one of your slides you were talking about, um, getting state approval. This person got a state approval for selling home canned goods, but they're wondering if this pertained to them as well. I'm not sure what the second part of that was, so that's why
yeah.
maybe
For
I'll
those
start a
kind of state
slide.
approval selling home canned goods, does this pertain to them as well? Yeah, I mean, if it's recalled, for sure, right? So you need to have an idea where your product is going, um, where your product is going and what kind of traceability protocols can you apply. Now, keep in mind that if you are canning at home, canning is a high risk operation. So talk to your local extension people, people that can provide support and are you using the right temperature, the right materials? Is the pH adequate to control for Clostridium botulinum, which is what really we're trying to control. So really keep those things in mind.
Okay, and one of the other folks, I just threw that in the chat, but somebody actually had put that in for us that master gardeners provide training with food safety procedures for produce that they bring to the food pantry. So that's great. I should know that. I help out the master gardeners with a lot of their Zoom stuff, and I guess I missed that part. So that's awesome. Thank you for that. Um, what's another comment there
Yeah,
that came in, Byron?
I think there's one that it's about colors, right? So why does the FDA allow product in food like red dye number 3? So red dye number 3 was just banned, right? So manufacturers can no longer use that. They have to reformulate, and starting January 15th, 2026 or 2027, they can't have it in their products. Carrageenan gum has not been proven to cause cancer. Okay. So one of the main things that we have with all of these chemicals that are used in foods is that some have been proven for many, many years to be safe, and for some, there is a level of incomplete information. Right? But the evidence points towards no cancer caused by carrageenan, right? So I've heard of this before, and I don't think that there's any conclusive evidence. Now, can many other ingredients be causing cancer? Yeah, I mean it could be, right? But at the end of the day, we need safety assessments. And just FYI, a bunch of people that do chemical food safety assessments were just fired from the FDA.
The valid point to mention there. Well, that is all the questions that I have seen that have popped in. Unless, right, Byron, did you see any? I don't think there's anything else that.
No, I
Think we got through them all, and it's
yeah,
right about 3 o'clock, so right on
yeah.
time. Very
So
good timing.
thanks so much for the questions, and feel free to reach out directly to me if there's anything I can do to help.
Okay, one just popped into the Q&A asking about wild mushrooms. Well,
Ooh, wild mushrooms.
that's a
I would talk to your local Department of Ag, right? Because they can really tell you what do the toxigenic species look like. Because you can use mushrooms for two reasons, right? You can really eat them as food, or you can use them the other way, right? So
yeah. Well, awesome. Thank you so much, Byron. Great job. Great presentation. You're getting lots of good kudos down there in the chat. Thanks everybody
thank
for
you.
joining us. We'll be back again next week.
Bye, everybody.